Hello viewers, welcome to Care Positive Life series. Today's episode is dedicated to diabetes. While you can refer to many reports doing its round, one specific report says India has 69 million cases of diabetes. And the threat part is, between year 2000 and 2015, the incidence has grown by 100%. So it's something that needs to be discussed again and again and understood properly. To understand about diabetes, we have come to Professor Dr. Anoop Misra. He is the chairman of Fortis-CDOC Hospital and he's a man with many laurels. From him, we'll try to know the finer nuances, what is the current status, what we need to do, and what is research doing to take care of our health. Over to Dr. Misra. Sir, thank you for your time. We were reading a report which says that India has around 69 million cases. This report is in 2015. And over 15 years, the incidence has grown by 100%. Why this sudden rise in diabetes is something that we'd like to know from you. But we'll start from the very basics. Sir, if you can please explain what is diabetes?
See, diabetes is when the beta cells of pancreas is the endocrine gland in the upper abdomen, which secretes insulin, and these beta cells, they formulate insulin and secrete it, and this insulin actually lowers the glucose. But once there is a deficiency of insulin, or if there is a resistance to the insulin, then the blood glucose starts rising. In most common scenario, it is the obesity, increase in the fat in the body, which produces resistance to the insulin, and such people will have increased tendency for diabetes. There are various kinds of diabetes, of course. This is typically type 2 diabetes. There is type 1 diabetes where these cells are totally gone. Some process destroys these cells, and there are various other kinds of diabetes. But most common throughout the world is type 2 diabetes, where the obesity is the main risk factor. Now, as far as India is concerned, the diabetes was already increasing. It's not 15 years, it is almost 25 years. It was already increasing, but the curve which was increasing was not discernible by most people.
Right.
It crossed the threshold by 1995, 2000, and then people were wondering what is happening. When I went to Health Ministry in 2000 and formulated the nationwide plan for diabetes control, they will not believe that this is an important problem for health in India.
Right.
And they say tuberculosis is a problem, malaria is a problem, we have to fight that, the funds should be allocated there, but not for diabetes. We had a hard time explaining to them that this is a rising problem, it is going to consume this country in a short while. And this is what happened. Once various agencies, WHO and everybody really put the figures in front, then everybody started looking at that, and now it's everywhere. Every family has a person with diabetes.
Right. So, before you explain the basic human ecosystem that is being affected by this one singular problem, why does diabetes happen?
Most of the people, that diabetes will happen if there is resistance at the cellular level in the action of insulin. So, what insulin does is, it enters the cell through one, and once it enters the cell, the glucose starts coming in the cell and starts being used as energy. Due to some factors, the insulin doesn't enter the cell, what is called the insulin resistance. The moment it doesn't enter cell, glucose also doesn't enter. The cell will be devoid of energy. We have fatigue. The sugar which is outside the cell cannot come inside the cell, it starts rising. It causes increase in the urination. It causes various other bad effects on every part of the body. So, this is at the cellular level.
Right.
But the basic cause, as I told you, is obesity, and the most of the obesity is the fat over the abdomen, inside the abdomen. and in the liver and in the pancreas. So, all these organs which are metabolizing glucose every minute and keeping them it under control are full of fat in Indian people versus the other people. If you take a white and same weight Indian person, so my weight is 75 kg and a white is sitting here with 75 kg, and if you do certain studies in me, my inside the abdomen will be full of fat, my liver will be full of fat, my pancreas will be full of fat, versus a white or a black person whose abdomen will have very little fat. Now, why does this happen and why Indians have more fat in the body and in the liver? Nobody knows. Likely to be genetic predisposition, but likely something has happened in our metabolism over the centuries which has put us into this state.
Sir, if you can highlight on the ecosystem bit, you already mentioned that the insulin not coming in, so the glucose is not being absorbed by the cell and energy is not being formed, and it is having its effect on various body parts. So diabetes actually affects many more diseases than just diabetes alone. So what would you like to say about this?
Every system of the body. It is, when we were students, our teachers told us, if you know syphilis, you know the medicine, because syphilis will affect every system of the body. Now syphilis is gone. Now everybody says if you know diabetes, you will know the whole body. So if you say from the brain to the eyes, to the heart, to the lungs, to the liver, pancreas, intestines, sexual organs, bones, muscles and nerves and kidneys, everything is affected in some way or the other. But primary attack of diabetes comes on the kidneys, nerves and eyes. Three primary attack organs, and foot, of course it includes nerves and the blood vessels, and equally important attack will come on the heart and the brain as a heart attack and the stroke. So these 5 primary attack organs and then subsequently several other systems which are. So a patient comes to me with some other problem, he thinks it's not due to diabetes, is most of the time is somehow related to diabetes.
Right. Sir, by the time the symptoms surface, it usually becomes too late to reverse the effects of diabetes. So how does one detect early? I mean, how do if somebody comes to you and you find that he might be having a problem, but the source is diabetes, so is there any way for early detection?
Oh, absolutely. In fact, we always say that if a lay person can remember what are the various factors which lead to diabetes, then early detection is very much possible. So let me just enumerate some of the factors for you. We have already said increase in the weight, increase in the abdominal circumference, so people who are totally sedentary, not doing anything during the day, just sitting, desk job, not exercising enough, not taking enough fruits and vegetables, then the mothers who have given birth to a baby which is more than 4 kg at the birth time, people who have blood pressure, people who have some sort of a cholesterol problem, people who have heart disease, all these are at increased risk, and Indians as a race are at increased risk. Okay. Now there are certain other things which a non-medical person can see in a person, say, well, this person may be having diabetes. Very interesting. Excess fat below the chin, double chin. So you can identify, anybody can identify a double chin in any person. There is a dark pigmentation at the back of the neck, which is called acanthosis nigricans. So if you see the neck and there is excess fat here, and the dark pigmentation at the back of the neck, this person is a high risk for developing diabetes. So whenever we tell a person, person asks, well, what should I see in a person to see? Our students, we tell these are the things that you should see in a person. Now, if a medical person is examining a patient, then what could be other things that lead to increased risk for a liver which is enlarged? So one can see liver with the hands, a trained person. If liver is enlarged, our research has shown that more than 15 centimeter of total liver almost 5 times more risk for it. So these are some of the things which are emerging from our own research.
Right, right.
And we have done plenty of research like this where we have said, well, this is the thing that you should look for.
So, in fact, you have already touched on research, and you have more than 300 papers in your name in various medical journals. So, sir, if you can highlight on the various frontiers we have achieved in terms of research on managing diabetes and the identification of the various factors which leads to diabetes.
So some of the factors I have
Yeah.
already listed are those factors like obesity and all those 7-8 things that I have listed will lead to diabetes. But still there are some people who may be thin still and they may not be obese and they still may be highly prone to diabetes. Who are these people? Who have family history of diabetes. So simple to ask a person, well, your mother, father or brother have diabetes? If so, they are at very high risk even if they are thin. So that is a certain factor which should be asked in every person. Now, if we catch a person like this and do the blood glucose and find that this person is having slightly elevated sugar, not exactly diabetes, but pre-diabetes, that is a very important condition because that's where we should catch most of the people and prevent diabetes from happening. Ideally before that, before development of pre-diabetes, but certainly at pre-diabetes. And if a person, Indian person has pre-diabetes, he rapidly converts to diabetes as compared to a white person or a black person somewhere outside India. So we have a high propensity of conversion to diabetes. And so we have to diagnose diabetes, as you rightly said, catch diabetes early, and the Indian government at this point of time says that everybody over 30 years of age should be screened for diabetes.
Okay. So, coming back to that pre-diabetes phase, we generally know that diabetes is not curable. So, can we, if we identify somebody at a pre-diabetes stage, is it possible to cure him completely?
Oh yes. Now those days are gone when we used to say it is incurable. That incurable word for first couple of years of diabetes is no longer applied because of several research papers which have come recently. So pre-diabetes can be reversed very well with the right kind of diet and exercise, and especially in people who are obese. So say for example, a person who is 110 kg and with a fasting sugar of 110, a post glucose sugar of 170-80, which is not exactly in diabetes range, if this person reduces 15 kg of weight, he will reverse his diabetes.
Oh, very good.
Plus, if he reduces less than that, say 5 to 7% of his body weight, over 1 year or 2 years, he will still be able to reverse his pre-diabetes. Even if this person develops diabetes, we can still reverse it by losing weight. Problem comes when the person is not obese.
Right.
Then we cannot do much as far as weight is concerned. How this concept has been reversed in recent years is by advent of the bariatric surgery. So people who are 110, 120 kg of weight, they underwent massive weight reduction with a bariatric surgery and their diabetes was totally reversed. Not a single drug needed where multiple drugs were needed. But this can happen only if the diabetes is not very old, something like 2, 3, 4 years of, and certainly in pre-diabetes stage.
So, if somebody is identified as a person who is diabetic, so what are the precautions that person needs to take other than the standard jogging in the morning, or I mean the physical part of it and the food part of it? What are the other things that the person should do?
If you come to my office, I have something written at the back, say knowledge and discipline, and you will overcome diabetes. A person should have enough knowledge about diabetes, because those people who are badly managed are the ones who don't know. So it's our job to educate them. So first thing is, right when it is diagnosed, they should know at least basics of diabetes and what it can lead to. And discipline, then discipline in, you said jogging, walking, diet, and medicines, whatever medicines are prescribed, and the sugar monitoring. If these things are done, at least half the job is done. Then they have to get checked for the basic complications. So there are some very simple tests which tell us early damages.
Right.
Very simple test. So people think, oh, I'll spend thousands of rupees for detecting with a complication. No, very simple. Say maybe 500 rupees, maybe 600 rupees. Just a urine examination, just nerve testing and eye testing. Three things will detect any damages, and those damages in early stages we can contain. So the knowledge, discipline, regular follow-up and regular checkup for complications.
So interestingly, various reports point out to the fact that in the yesteryears, the people in the higher echelons of society were more sedentary in lifestyle, their eating habits were a little westernized, so they were more prone to diabetes. But now we see there's it is being very democratic across the mass. So what could be the reason for this?
It's not exactly democratic. Actually, it is percolating down the socio-economic strata. Reasons are very clear. This always happens. There are various phases of the nutrition and lifestyle transitions, and this has been, 5 phases have been described. The 4th phase is what you are saying, that such lifestyle diseases strike the people who are affluent and who have money to eat and alcohol, everything. But those people are getting educated. They are getting educated about the diet. They can afford expensive and healthy oils. They can also afford a treadmill, a whole gym at home,
right,
or have a membership of. So these people are educated, and there the diabetes incidence is decreasing. And people who are middle socio-economic strata, now who are still, though they have increasing amount of money, but they are still living in smaller places, smaller homes, congested places where there's nothing much to walk outside. They don't have any apparatus for exercise. They have that tendency of yesteryear where you go to some place, you eat as much as you can because there will be no meal tomorrow, maybe.
Right.
Famine situation. This was the mentality which has been ingrained to us by our grandmother. You must not leave anything on your plate, or you go there, bhar pet khaiye, full stomach. Still existing in the middle class. So they will go to parties, they will overeat, and they don't know what to eat. Their education regarding the nutrition and exercise is virtually 20%. 20% of the 100 people actually know. So, and the low socioeconomic strata don't know anything. They will eat anything. And most of them will use cheap, partially hydrogenated vegetable oil, which is vanaspati,
right,
and cook all sorts of things, pakoras, etc. It is filling also, and this they can make it very well at their home, parathas, pakoras. They will eat whenever. Actually, meal time is something they look forward to,
right,
and a fried thing that they look forward to. Now here in the higher socioeconomic strata, they will have salads for dinner or something, maybe olive oil on the top of it and things like that, while the other person will eat paratha and dal with a plenty of butter over it. So this is the situation which is existing in it.
So you have a very strong background in research, and beyond the 300 papers, you said something very, very striking. While there is a belief that Western food culture has influenced India, is there any specific demographic who are much more vulnerable? I mean, there are certain predictions that if you have diabetes in your family history, it's a possibility. But is there any demographic significance that you find in research that this kind of people are more prone to diabetes rather than a specific set?
Well, one thing which as a group which is becoming more important are the are the children in teenage years, because they have access to the food at home and they have access to food outside because they have money. Most of them will be from the public schools. Government school children are still thin, but we have done plenty of research on these children from the public school who are increasingly becoming obese, and they are not going to play, you know.
Sedentary lifestyle sets in much earlier.
Absolutely. And most of them will just concentrate on studies and so on. So, these are the people who will develop diabetes very fast, and our research has shown that between 15 to 25 years, their various blood parameters shoot like this, absolutely, between 15 to 25 years. And by 25 to 30 years, they start having high sugar, right. And by 30, 35, heart disease. So, everything is a decade and 15 years earlier in the current generation, and they are having an Indian junk food and a foreign junk food. And the second, I have already told you about, right, the middle class and, right, lower middle class, which are women. Women are particularly prone. Now, most of our research has shown that women are more obese than men. Why? One, a culture in women that if they are not going to go outside to walk, or some women will be shy or security conscious and things like that. Multiple pregnancies, they increase weight, and then by 35, 40 they stop looking after their appearance and so on. Western women who are 50, 55, they look after their appearance very well. They jog, they walk, and so on. So, women are more obese than men. They have equal incidence of diabetes before menopause and after menopause, very fast. Right. So, these children, middle socioeconomic strata, and women are our vulnerable groups.
So, there is an interesting trend which is there, and we would like to vet it from you. The interesting trend is that people are junking sugar and they're replacing it with sugar-free substitutes. Would you support that?
Well, there are pluses and minuses of sugar-free substitute. When they came and they were, everybody thought that if we replace sugar with these sweeteners, artificial sweeteners, then they will decrease their energy intake, and many of them will not develop diabetes, or those who have diabetes will get better, and so on. This initially around 10 to 15 years from 1980s to 1990s perfect. Then there are a couple of research which came in 1990s and early 2000 that they actually don't decrease satiety, and in fact the appetite goes up after intake of these artificial sweeteners. So, you eat more, overcompensate that. So, sugar actually decreases your appetite, and brain recognizes that this is sugar, and I have enough quota of sugar now. But with the artificial, brain doesn't recognize that. So, the mice, when the experiment was done on the mice were given this, they ate more, they became fatter. So, actually it is counterproductive in terms of your energy intake. So, you may think that you are having some cola which is this, and you are just 0 calorie or 5 calorie or 10 calorie, but you will eat something more. Now, as far as there are several other effects, side effects have been considered with this, but most of them have been considered as safe by the US authorities. But in whatever advice we give to our patient, we say, well, you can take a little bit of artificial sweetener, but say if it's pellets, then 2-3 pellets. If it's drops, not more than 5 drops, 1 or 2 sachets per day, and not more than that. In fact, we allow many of the patients sugar intake. Our diabetic patient also sugar, so they can mix a little bit of sugar and the artificial sweetener in their morning tea, and so on. So, our this thing will be restrictive as far as this is concerned, and not ad lib, right, that you, right, can take.
So, MyNaCare viewers are very thankful for the inputs from you. It's rightly said that if you have knowledge about something, you will be able to take care of yourself. So before we sign off, we'd like to get some inputs from you for our viewers. What would be your input to our viewers as far as diabetes is concerned?
I'll give a very clear advice to everybody across the ages, across gender, that if you maintain 45 minutes of moderate intensity exercise right from the very beginning, from 10 years onward, children, and up to 60, 70 years, small amounts of weights every day, 1-2 kg of weight. We always tell all our people, you do weights, our muscles are very weak. We should build up the muscles. So, two exercises. One is aerobic exercise, second weights, and in the food, if you take 5 servings of fruits and vegetables, green vegetables, oats, nuts, handful of nuts, and healthy oils, which is many healthy oils are available, olive oil, canola oil, rice bran oil, even mustard oil. So, if you have such food which is healthy and good amount of exercise, mix of aerobic and strength training, maintain your weight right from the very beginning. We have, our mothers say, if you're fat, then they'll say healthy. Not such a healthy weight, but body mass index which is well within normal range. I think your chances of becoming diabetic will be very low, and those who are diabetic, if they follow this, the chances of having complications will be low.
Sir, thank you so much. We really appreciate your time. Thank you so much.
Thank you.